I'm Rachel Degar, and this is the Truth About Aging podcast. Today I'll be speaking with Dr. Kristen Carmela, which was such a pleasure. Kristen is known as a trailblazer at the intersection of science, medicine, and healing, and a pioneer in regenerative medicine. Her stem cell career has spanned decades, although it's still seen as a fairly new way of treating people. I learned so much from Kristen during this interview. Who knew that the pelvic floor muscles could be strengthened using stem cells? If you want to learn about so many things that you never even thought to use stem cells for, listen to Kristen Carmela now. I hope you enjoy it.
Join me and experts from all over the globe sharing knowledge with you about living healthy longer, smarter, fitter and happier. Scientists, doctors, researchers and biohackers. You'll learn everything here about how to be your best you. I'm Rachel Degar. Welcome to the Truth About Aging.
Well, I have the pleasure of being with Kristen Carmela, who is the top stem cell scientist in America. I had the pleasure of meeting her at RADFest last year, and she's just an incredible speaker and a real visionary when it comes to moving stem cell treatments forward. But what we're going to do is take her right back to the basics today to tell it, because stem cells are becoming more normal. So let's find out what they do for us. Hi.
Yeah, so the concept is that every single one of us have stem cells inside our body, and the main purpose of these cells is to maintain and heal tissue where they reside. And so what we have done is taken this to the clinic and actually applied it to patients. So the idea is we can harness stem cells from one location in your body and put them exactly where you might need them in greater numbers. So maybe you have something wrong with your knee, or maybe you've got something systemic going on, or maybe something neurological in your brain. And as it turns out, fat tissue is one of the most plentiful sources of stem cells inside our body.
What a shame, you have to take my fat out.
Yeah, so it's a relatively simple procedure. Patients can come in, they get a mini lipoaspirate procedure, which means that we numb just below the skin and we remove a small sample of fat. The patient stays awake during the whole procedure. Takes us about 30 minutes to isolate the cells of interest, and then we can deliver those right back to the same patient.
So it's all in the same treatment?
Yes,
Out and in at the same time?
The first treatment is all done right there, about 2 hours in clinic. Now the second thing that we can do, and these are some newer protocols that we've been pioneering, is take an additional sample of fat tissue and then send that to a laboratory. We can culture expand the cells and get additional doses so that you can use them for future treatments should you need extra treatment in the thing you were trying to treat, or for other things. Maybe you just want to do general anti-aging and do an IV of stem cells and allow those cells to systemically bring down inflammation.
Because I guess that's the way to go, because you end up with more stem cells. But one could say, why has the body not got it right? Like, if my knee really needs repairing and I've got these beautiful stem cells sitting in my fat gut, why aren't they going there anyway?
They are. And so the body really does have it right. The stem cells are naturally going to these areas of injury. So all we're doing is tapping into this technology that exists and just giving a little tweak up, turning the volume up just a little bit to allow a little bit more healing where you need it especially. And the other issue is that as we age, we have less stem cells circulating, and so we're just kind of giving a little assistance to the body for its natural healing process.
Cool. So we're helping it do what it's going to do anyway.
That's right. This technology exists inside you. All you have to do is harness it and tap into it.
Yeah. Do you know, that's what I love about most of the anti-aging and longevity and, just living better treatments, is that we're taking our cues from nature anyway.
Absolutely, and I think that this is an opportunity for patients to address the entire regenerative medicine picture and start thinking about your body on a cellular level, and everything that you introduce into your body can be affecting the cells and the stem cells that exist inside your body. So if you detoxify your life, get rid of any toxins from your diet, toxins from your environment, you can really optimize your cellular health. Then combine that with these stem cell therapies, you have a wonderful opportunity to live longer and healthier.
Oh, cool. And if you Have you noticed a change in people's attitude to stem cells?
Absolutely. Probably about 5 years ago, I had to beg people to listen to me about stem cells. Now they're banging down the doors. I think you're seeing a lot of famous athletes or famous actors talking about regenerative medicine and stem cell treatments or platelet-rich plasma, and it's becoming more mainstream. It's becoming more accepted. And we've really pioneered so many different indications. We can use stem cells in so many diseases because these cells can help to repair damaged tissue, which is really the root issue in any disease.
Yeah. And so I remember maybe 20 years ago when I first heard about like banking stem cells and things like that, and I was like, oh my God, that's just so weird, and what would you even do with them? But I have a 6-year-old and a 3-year-old, and we banked the stem cells from their umbilical cords. I was just like, why wouldn't you?
Sure.
But if someone hasn't done that, have they missed the boat?
Yeah, no, what you want to do is bank your stem cells as an adult. You have stem cells that exist inside your fat tissue, and you can lock in the youth of your stem cells today. So
you'll never be as young as you are today.
You'll never be as young as you are today, unless you start dosing with stem cells. Then maybe you're getting younger.
Yeah.
But absolutely, you have an opportunity to do that right now. You didn't miss the boat if you didn't do it when you were a baby.
Mm-hmm. And so, what things in particular? You know, quite often people will get a condition or a disease or something, and go into a traditional GP or Western medicine, and then 5 years later, when they're actually more and more ill, wish they hadn't have begun that path. What things in particular would you say just come straight?
Yeah, I mean, I wish that we could see a lot of these patients earlier on. Oftentimes the patients that present to us are later stage in their disease because it's not necessarily the first thing that a patient considers. I would say the most common indication that we treat in the clinic is orthopedics. Patients with arthritis, osteoarthritis, or patients with injuries, tendons, ligaments, and we can repair those. There's no need to cut tissue out. We can repair the tissue. Probably the next most common is going to be lung disease. We do a lot of patients with a disease called COPD, and we can get those patients off of oxygen, get their exercise capacity up. And we also do a lot of neurological conditions. So this is anything from Parkinson's to MS to spinal cord injuries to brain injuries, and really anything systemic. Autoimmune diseases, we can help to reset your immune system by using the stem cells to bring down the inflammation in your system. And I think there's probably a lot more diseases that we haven't even thought of yet that could be applied, stem cells could be applied to.
Yeah. Let me ask you a really silly question. So in like autoimmune diseases, your body it's just doing the wrong thing, right? If you take the stem cells out and put them back in, are those stem cells not still obliged to do the wrong thing because they've got it wrong?
Yeah, so what's happening is it's actually more your white blood cells that are misbehaving. They're over-inflaming, and they've kind of gone wacko, and your system is just creating nonstop inflammation, and inflammation tends to create more inflammation. Naturally, the cells that are responsible for quieting down the white blood cells are your stem cells. So for an autoimmune type disease where you have an over-inflamed body, this is the perfect indication, and we see some miraculous results with our autoimmune cases.
Wow, that's cool. And then I was just listening to you on stage saying that you're injecting yourself with stem cells as a preventative.
That's right, yeah. So I started dosing myself probably about 5 years ago. I do regular IV therapy every 6 to 12 months. I'll do an IV of stem cells just to bring down inflammation and hopefully live longer. I've also done injections in my knees, in my shoulder, and most recently I've done an injection in the vaginal wall. As a mother
I was
of
so
two,
excited when she said this. I haven't been on a trampoline in 6 years.
Oh yes, you pee your pants. As a mother of two, they're teenagers now. For years I peed my pants, and I didn't want to do jumping jacks, or anytime I felt a sneeze coming on, I was getting nervous. But not anymore. I don't pee my pants anymore. But also, by placing the stem cells into the vagina, you can help to improve the blood supply. So this means better lubrication and stronger orgasms because you have more blood going there. And this applies for both men and women.
Yeah. I'm so excited. Well, because it always hinders your personality.
Yes.
When you want to jump up and down and you go, oh, when did I last pee? I can't jump up and down.
No, it's true.
So it's really interesting that you can do so many different things with stem cells. Now, you don't have knee problems or shoulder problems or anything like that. And I guess the big message here is don't wait until you have a problem.
So if I went to the gym and I just felt a little tweak on my knee and I was having a little bit of pain, that next day I'm doing a stem cell injection. I'm not going to wait until I have bone on bone. I want to keep my cartilage intact and healthy for the long haul. I want to be able to do hard workouts for as long as possible.
Yeah, cool. And more people are shifting towards that
prevented
thought.
it.
Yeah.
Yeah.
I think we were always trained traditionally that you go to see the doctor when something's wrong.
Right.
And then regenerative medicine comes along and you go and see them when something's wrong now.
Yes. Yeah.
So it's just a shift that is happening.
Yeah, tap into your healing potential. You've got the opportunity right now to get some of these therapies. They're going on, and the field is growing. It's expanding. We're really going to change the way we treat so many different diseases.
I love the information you're giving us. Now about you, what's the most exciting thing that you're working on at the moment?
I love treating patients. That's really the most rewarding thing. So when we have a patient that comes into us who has lost hope, who traditional medicine has failed them, and we can convert them to a happy, healthy, contributing part of society, this is why I do this every single day. I love it, and it helps me be happy, and it's great to see other people be happy.
Cool. Keep on changing lives. We love you. Kristen is awesome, and as you can probably tell, a little bit friendly and really open and intelligent. So if you have any questions, please contact her, Kristen Carmela, and I know that she will help you out and see you right. Thank you so much for talking to us.
Yeah.